This is Dr. Peter Crane. Thanks for tuning in for another installment of our Healthier You video series. Well, prostate cancer is pretty common. Approximately 12% of men will get prostate cancer during their lifetimes. It is common. The challenge is understanding that while men do carry prostate cancer cells, the very large majority of men will not actually have symptomatic prostate cancer or metastatic prostate cancer or any type of cancer disease process in their normal lifetimes. So it's common, but the percentage of men who get significant cancer is very low. It's pretty controversial. If we screen every single man starting at age 40 or even at age 50 with a PSA test, we find a lot of people who have abnormal PSA tests, and eventually a lot of those men end up getting a biopsy or even a prostate removal surgery. And a lot of people argue that when we do too many of those procedures, we actually cause a lot of side effects or unintended consequences from all the medical procedures. And some studies have suggested that more men actually die as a result of procedures than were saved by having the prostate cancer screening test in the first place. So it is pretty controversial about whether or not to do generalized screening tests. Well, I think it's important to distinguish between a diagnostic test and a preventative screening test. A screening test says I'm screening everybody in the population with no symptoms to see if we can detect disease really early in the process. A diagnostic test is a person comes to me and says, I have these symptoms, and we order testing or diagnostic things to determine what is going on. So a screening test needs to be able to detect the disease process early and be able to do something about it so that we intervene and prevent the person from having cancer. So the decision about whether or not to be tested in a test like a PSA test really needs to be a discussion with your doctor. Well, you really should talk to your primary care physician. That person knows a lot about you and your history. Your doctor really ought to be your main source of information on that decision, and you can make that decision together. There are some good online resources. The CDC, the Center for Disease Control for the United States, has a great website. The Mayo Clinic also has a website. Also, the American Cancer Society also has a lot of good information out there for patients with more questions.